Here is the section of head and neck where we can see the larynx. This anterior part of the neck in front of the pharynx and esophagus, and in front of this vertebral body, this is the larynx. This larynx is related with third, fourth, fifth and sixth cervical vertebra, and the larynx serves its function through two vocal cords. These are the vocal cords, and this larynx is a cartilaginous framework which is supported by muscles, ligaments and the membranes. Now we see the close-up view of the larynx. Here is the section through the larynx where we can see the main structures of the larynx. Here we see the vocal cord. This is the section and it is on side of the larynx. Here we see the cartilages of the larynx. These laryngeal cartilages are single number cartilages are the epiglottis. This is the epiglottis. This is the thyroid cartilage. This is the cricoid cartilage. These three cartilages remain singly in the larynx. If we see the larynx from the behind, we can see here is the whole thyroid cartilage, here is the epiglottis and here is the cricoid cartilage. If we see the larynx from the front, here is the thyroid, here is the cricoid and here is the epiglottis. Now the paired cartilage. Here we see two paired cartilage. These are the arytenoid cartilage. In the posterior view, here are two arytenoid cartilages. In the apex of the arytenoid cartilage, there is another small cartilage, that is the corniculate cartilage. And cuneiform cartilage is not visible here because it remains in the fold in the living body. It is very small, it cannot be seen here. If you can imagine, it will remain above this corniculate cartilage. These three cartilages are the paired cartilage of the laryngeal framework. Now the epiglottis. Here is the epiglottis. This epiglottis has the upper end and the lower end. The upper end projects above the hyoid bone, and the lower end is attached with the thyroid cartilage in the anterior part where the two lamina meets here. This epiglottis is connected with different structures, and in the pharynx we can see here the superior view. Here is the epiglottis. Here we see the vocal cords. Here is the arytenoid, and the epiglottis is attached with the arytenoid through the array epiglottic fold. Here is the array epiglottic fold, and epiglottis is attached with the tongue. It is the posterior border or the root of the tongue. It is attached with the median glossoepiglottic fold. Here are two lateral glossoepiglottic folds. In between the lateral glossoepiglottic and the median glossoepiglottic fold, there is the vallecula. Here is one vallecula, here is another vallecula. These are the vallecula. These are the superior view of the larynx and the attachment of the epiglottis. Here is the raw epiglottis. This epiglottis is leaf-shaped structure, and it has some perforations throughout its body. Now the thyroid cartilage. This thyroid cartilage has two laminas. Here is the right lamina, here is the left lamina. These two lamina fuses in this anterior part, but the posterior part, they are not attached with each other. Here we see the anterior part of the fusion of two lamina forming a notch in the upper part. This is the thyroid notch, and this prominence is known as the Adam's apple or the thyroid angle. In the posterior part, these two thyroid lamina remains apart from each other. There is the gap in this posterior part of this thyroid lamina. In the thyroid lamina, there are two horns, in the superior horn and the inferior horn, and there is an oblique line of attachment of the muscle. And the attachment of these two lamina, here we see the attachment of the inferior horn of this thyroid lamina with the cricoid cartilage and the superior horn with the hyoid bone. This is the thyroid cartilage. Now the cricoid cartilage is the anterior view, is the lateral view, and here is the posterior view of the cricoid cartilage. In the anterior view, we see it is a signet ring-shaped structure. The anterior part is the arch and the posterior part is the lamina. And there are some facets over this cartilage. This is the facet for the articulation of the arytenoid cartilage. Here is the facet for the articulation of the thyroid cartilage. Is the posterior widest part of the cricoid cartilage is known as the lamina. Here is the arytenoid cartilage. This arytenoid cartilage has the base and the apex and three surfaces. The three surfaces the process and the two processes. Here is the vocal process and here is the muscular process. These are the different cartilages of the laryngeal framework. Now we see the cartilages attaching in the larynx in situ. Here we see the thyroid cartilage and here is the cricoid cartilage. These two cartilages attached with each other. Here is a inferior horn of the thyroid lamina that is attached with the lamina of the cricoid cartilage, and there is a muscle. This muscle is has the origin in this cricoid arch of the cricoid and attaches in this lower border of the lamina of the thyroid cartilage. This is known as the cricothyroid muscle. This is the cricothyroid muscle. Now we remove this part of the laryngeal thyroid cartilage and we will see here. Here is the epiglottis. Here is the cut end of the thyroid cartilage. Here is the cricoid cartilage, and this part, this muscle is removed. Now inside the thyroid cartilage, we will see here is the arytenoid. Here is the cuneiform cartilage. From the arytenoid up to the epiglottis, there is a fold. This is known as the array epiglottic fold. From the arytenoid to the thyroid, this muscle is known as the thyroarytenoid. And the arytenoid is attached with the cricoid cartilage through different muscles. Here is the lateral cricoarytenoid. Here is the posterior cricoarytenoid. These are the intrinsic muscles of the larynx. If we remove this part, and here we see the cricoid cartilage, here is the arytenoid cartilage, here is the thyroid cartilage, is the angle of the thyroid cartilage where two lamina fuses. Here we can see the vocalis muscle. It is from the vocal process of the arytenoid. The vocalis muscle is attached to the thyroid cartilage. We have seen these two muscles, posterior cricoarytenoid and lateral cricoarytenoid, and the other muscles with the arytenoid, two arytenoid cartilages. Here is the oblique arytenoid, and here is the transverse arytenoid. Here is the transverse arytenoid. These are the intrinsic muscles of the larynx. All these muscles has the action on this vocal cord. Here is the vocal cord in the closed view. Here is the open view of the vocal cord. This muscle can open and close the vocal cord and can relax and tight this vocal cord, changing the vocal pitch, vocal tone, and all the activities of the phonation. And these muscles are supplied by the nerve, two nerves. One is from the above This is the superior laryngeal nerve, and another nerve is from behind. This is the inferior laryngeal nerve. But this inferior laryngeal nerve is known as the recurrent laryngeal nerve, as because both the superior and inferior laryngeal nerve originate in the head and they descend downward. From here, the superior laryngeal nerve enters in the larynx, and the inferior laryngeal nerve or the recurrent laryngeal they passes downward through the arch of aorta. Here is the vagus nerve. Here is the left vagus nerve. This left vagus nerve reaches to this arch of the aorta. From here, there is a nerve that is known as the laryngeal nerve, but they passes underneath the arch of aorta, then moves upward and naming the recurrent, as it again passes to the upward. So this is the recurrent laryngeal nerve, left recurrent laryngeal nerve from the arch of aorta. In the right side, here is the subclavian artery. In the subclavian artery, the right recurrent laryngeal nerve passes underneath the right subclavian artery, and it is the recurrent laryngeal nerve. So the larynx is supplied by the superior laryngeal nerve and the recurrent laryngeal nerve. These are the intrinsic muscles of the larynx. All the intrinsic muscles of the larynx except this cricothyroid. All these intrinsic muscles are supplied by the recurrent laryngeal nerve. This cricothyroid is supplied by the external branch of the superior laryngeal nerve. This is the nerve supply of the larynx. And blood supply of the larynx. Larynx is supplied by the superior and inferior laryngeal arteries. And the superior laryngeal artery comes from the superior thyroid artery, and inferior laryngeal artery comes from the inferior thyroid artery.